It's normally discovered by, honestly, kids having to use the restroom like an excessive amount. It's really obvious. If a little kid is asking to use the restroom every half hour, it's pretty good to take them to the doctor and see, because you'll never know from them going low, because obviously there's no insulin that's going into them. So it'll always be from their blood sugar being really high that you'll start to see the symptoms. And it's normally easiest to see based on how often they're using the restroom. So if your school starts complaining that your kid's going to the bathroom way too much, then it's time to go take them to a doctor. They'll always do a blood test. If you happen to know somebody that has a meter to test their blood sugar, then that's a great way to find out. If it's over like 300, then actually if it's over 100, then they're definitely diabetics, because the average blood glucose for non-diabetics is like 60, but that's not normal for diabetics. But anyway, but if you're starting to see symptoms, it'll be above 300 for sure. And that's how you know. There's also, this is going to sound really gross, but if you have like a really little kid and they're peeing a lot, if they're in diapers, smell their pee. That sounds gross, but it'll have a sweet smell to it because it'll have way too much sugar. So that's a great way to know that you should then take them to the doctor, and then they'll do several blood tests on them. They normally just do, in this day and age, they'll just do little finger pricks, and they can test it that way. Pretty easy, just like one of these little things that I carry around in my purse. And that's how you find out. So